Being 4:30, I'm calling the Wednesday, August 21st meeting of the Ayer Board of Health to order. First, our member, Ms. Peters, will read an announcement.
Okay. This meeting/hearing of the Board of Health will be held in person at the location provided on this notice. Members of the public are welcome to attend this in-person meeting. Please note that while an option for remote attendance and/or participation via Zoom is being provided as a courtesy to the public, the meeting/hearing will not be suspended or terminated if technological problems interrupt the virtual broadcast, unless otherwise required by law. Members of the public with particular interest in a specific item on this agenda should make plans for in-person versus virtual attendance accordingly. This meeting will be live on Zoom. The public may access the proceedings by joining Zoom meeting ID number 880-9915-1478 or by calling 301-715-8592. For additional information about remote participation, please contact Samantha Benoit, Administrative Coordinator, at sbenoit@ayer.ma.us or 978-772-8220, extension 145, prior to the meeting.
Thank you. So, to kick off public input for tonight, we had a request to appear before us by an emeritus, I would call her, member of Board of Health. So, by all means, you may absolutely go first. Thank you so much for coming. Would you like to come up, or do you want to speak from where you are?
No, I'm trying to drink some water, but my voice is still...
Oh, gotcha.
There's microphones down there, down at the table, though.
Yeah, you can just have a seat down at the end. Thank you very much for coming.
Madam Chair, I had the pleasure of serving with Mrs. Sullivan in 1981 and 1982.
You're dating me.
I'm the one that aged and you didn't. So.
Oh, gosh.
Tricia, can you open this? I am now a resident at Neshoba Park in Ayer, and I think it was one of the best decisions I ever made to go over there. It's a great place. I'm not sure of how many people are there. I'm not representing them. I already talked to the people over there, and I said, I'm not representing you. I just want to go over and say we have probably about 70 plus people here, and the ambulance comes there so frequently because we have a lot of people who just slip and fall, and they have to be seen in the ER.
Yep.
And it's mainly preventative, but a lot of times these people really have done some drastic damage, so they have to be, admitted. Luckily, Ayer has an excellent ambulance service, and those boys are right up to date, and I've even watched them. I'm an old nurse myself, and I've even watched them from afar. But they do a great job. They're really good.
They are.
And if the ambulance is running around to everything in the area, what's going to happen to people over there like us?
Yeah, I got you.
So we just wanted to know. They do have the option of going to other institutions, which would be Leominster, or Emerson. But we're concerned about it. And for people who don't know, this Neshoba Park is the original hospital.
Yes.
And some people don't realize that and don't know it. But
where I was born.
It worked. I was born there, and I worked there, and I had babies there.
That's fantastic.
And it does a great service. It really does. If anyone has not been over there, or I'm not sure what goes on over there, I suggest they come over.
Yeah.
It's wonderful.
You said there's about 70
I think
residents, you
I
think,
think
over there?
there's about 70 now. We had alpaca day the other day.
Oh, my God.
And the
I love
alpacas
it.
came
I love
in.
it.
Yeah, the
Love it.
alpacas were there,
That's fantastic.
and it was great. We had Mick and the boys today. They're a band of about 5 or 6 guys, and they come in and they played, and
That's awesome.
everyone was getting up. The meals are terrific.
Yeah.
It's just a transportation issue, but it's an issue in any other senior.
Absolutely, and that's something that we're concerned about, and we're trying to partner with Neshoba to just try to figure out what can we do. Is it expanding the services that Matt can provide? Are there any other resources available to us? But yeah, I've got you. If you can't get there or can't get back from there, those, regardless of the extra time it takes to get there,
Yeah.
but those locations are not a great option if you
No.
don't have the transportation.
No. And you know, when you talk to a lot of the people, they all have the same issues. It's always eyes, and they go up here and they sit in the doctor's office anywhere from 4 to 5 hours.
Oh, wow.
And then they have to wait for someone to come and get them and get back and forth.
Yeah,
And it goes on all the time.
So it's enough of a project as it is.
It
to
is,
get-
it is. And the senior center in Ayer, you know, they have the same problem. We have our own van, but we're looking for another driver.
Got it, yeah.
And I know they have the van down at the senior center, but we do, you know, we're able to use the van at the senior center.
And will they take you to medical appointments, or are they
Yeah,
limited in what
They will, but of course they're limited.
Helps, yeah, right. You only have the one van,
Yeah.
so.
I don't know, will they take you to Emerson or Leominster if
No.
this happens?
No, it's going to be in town.
Oh, okay, so if you have no.
It's Neshoba usually.
Yeah, right. But if they're gone,
Yeah.
what's the alternative? Yeah,
And the biggest
wow.
one up there is going to be the Dr. Velez,
Yeah.
and she does all the eyes, and I don't know where they're going to go.
Yeah.
The doctors have already signed a contract with someone else, I understand.
Well, I think they have a practice in Worcester as well, I think, Marcia.
Yeah, they do.
And I think they have privileges in Worcester as well.
Okay. Yeah.
Yeah, that was kind of an issue that I uncovered that I was going to talk a little bit more about later on, is that whole thing of making sure you understand where your physician has privileges
Yeah.
and,
Yeah.
you know, that whole thing, because it's a whole nother layer of complexity
Yeah.
here.
Good.
Yeah.
Yeah.
So I guess what I'd like to take back to my friends, I'm not going back to the powers that be, because
Yeah, I understand. Yeah.
I'd just like to know, are there any plans to increase, not buy another ambulance because they're very expensive,
Yep.
but to increase the people who will be able to,
I certainly hope so. And that,
because we need it.
yeah, and we don't have anything in place right now that we can offer you yet, but that's
Yeah.
definitely, transportation is very high on the list of things
Yeah.
that we're just trying to
Yeah, it is.
make sure that we have some kind of safety net in place. Yeah, I hear you. Thank you so much. Thank you. Thank you for all your years in nursing, too.
Oh, well, thank you.
Thank you. You were probably one of my nurses when I was in the hospital as a little kid.
How many years were you at Neshoba?
Were you there in the 60s?
Yes.
Oh, yeah. You probably, were you on the children's ward? I think I was in every bed in there at one point.
No, I was surgical daycare. We started up surgical daycare.
Yeah,
My daughter worked she was in the intensive care unit.
yeah.
So we were all there.
Yeah, another multi-generational
Yeah.
public health family.
Well, thank you so much.
Thank you. Stay tuned. I'm really hoping that we're going to be able to
Yeah.
Okay.
assist you here, but we're committed to, first of all, trying to see if we could keep the hospital where it is. That's choice number one. Nobody wants it to close.
Yeah.
Option two, if we can't have everything we want, then at least give us the 120 days.
Yes.
And that's where we're hoping that we can, at least that will give us some time to put some of these other things in place. So,
Yeah.
yeah, and we are absolutely committed to us as a Board of Health continuing to work with Neshoba, because then we can share information amongst all of the Neshoba
Yeah.
towns for what are these increased resources? What are some options? Where do you go? Where could you find resources? So we're working on it.
All right. Well, thank you very much. Appreciate
Thank
the
you.
time.
Thank you so much.
All right.
Okay, so we do have, it looks like, a number of people waiting. Is everyone there is for public input, or do we have, can you folks that are in the audience that want to do public input, can you kind of raise your hand so we know who's listening and who wants to provide input?
Do you want to do the letter first, or do you want to do?
Yeah, that's what I was saying. Well, I was thinking if we don't have a lot of public input, if people are more here to listen, then yeah, we're fine to.
There's
to
one
go on to
there's
that.
one in the chat, and there's 16 people altogether
Yeah.
in the chat. I don't know if,
So that would come up on our screen, right, when somebody
Yeah.
raises their hand if they want to.
oh, that's just a, yeah,
Yeah, okay.
okay.
All right, I'm not seeing any hands raised, is that right? If anybody is out there that wants to do public input, tell us. Otherwise, we are going to move on to the next thing, but stay with us because we are going to continue talking about Neshoba.
I can unmute them, or they can unmute themselves as needed.
Okay. So, on that note, then we have a couple of things to talk about with respect to Neshoba. We have invited people from the other Neshoba, Neshoba Associated Boards of Health, to join us tonight to talk about this. But prior to that, we actually have a document here that's been drafted by one of our board members that would go to, did you get any clarity on, like, should this be actually addressed to?
I did not get anything
Okay,
yet.
all right. So, should I read this? It's pretty short, or do you want to read it?
You should read
actually?
it, Steve.
Yeah,
Really?
read it, Steve.
Whatever.
So this is a proposed
Yes.
motion in front of the board, right?
So it would be a proposed that we adopt this letter, that it be sent to the governor, that it be sent to all the representatives, that it be issued as a press release as well to the news agencies if we accept the letter.
Okay,
Okay. Yeah.
all right.
So you read it.
Please
So
read.
the letter is the
Okay.
closing of Neshoba Valley Medical Center. Let it be known, the Town of Ayer Board of Health is making the strongest of recommendations to the Commonwealth of Massachusetts Governor Healy and the Massachusetts Department of Public Health Commissioner Dr. Robert Goldstein to uphold the Massachusetts state law and require Neshoba Valley Medical Center to transition to a closed status over 120 days. We ask that you vigorously petition the bankruptcy court to vacate the 30-day closure notice and amend it to 120 days to facilitate an orderly and humane transition from over a century of care, local health care. We understand how complicated this process is, but it can be done. The Department of Public Health has determined that Neshoba Valley Medical Center is an essential service and necessitates a DPH review of transition and closure plan. If the accelerated 30-day closure is continued, and this is underlined and italicized, you will create a public health crisis that is avoidable. Please consider the following: appropriate notification to all potential users of Neshoba Valley Medical Center, transition of care for all patients, identification of available providers and facilities for services, an orderly and thoughtful redeployment of emergency medical services, medical records retrieval, a pathway for access to essential life-saving medications, prescription drugs. Due to the rural nature of the area, transportation issues to and from the medical care, there are no municipal options, and so many more reasons. Neshoba Valley Medical Center is not like a dog food factory. If the dog food factory closes, someone else will make it. In closing, we were talking about people and lives, the young, the old, the frail, the poor, the weak, and the sick. We urge you in every possible way to extend the closing to 120 days. It's the right thing to do. And I would put that forward as a motion to the board that is the right thing to do, and that we adopt this letter to the governor, to the other town boards of health, to our state representatives, to the Ayer Board of Selectmen, but more importantly, that we issue as a press release as well. Because again, I would think for the governor, it's the right thing to do.
Yep.
And I totally understand she does not have control of the bankruptcy court.
Right.
But in the absence of petitioning them, I can't see how anyone would think that 120 days is not reasonable.
No, I can't either. I would I never know. Does she second it, or do I make? I want to just amend it.
Second it, and then you amend it.
Okay.
Okay, I second.
Okay. The amendment would be if we could, because I think there's like a typo here anyway.
There's a number of typos in
Yeah.
Yeah.
Oh, that's okay. Don't worry about it. If we could just add maybe the statement here, this is consistent with, and then a reference back to this, and then add this as an
Yes.
attachment.
I don't even think it needs to be an amendment. I think that is just
Okay.
what we should do.
All right.
But I think this needs to go out ASAP.
I agree, Steve.
And not just by email, but by certified mail, by courier if necessary. Time is of the essence.
It's time sensitive. Is that something that you take care of with, like, the mailing out and the getting a hold of, to go an overnight courier?
Yeah, absolutely. I mean, we can FedEx.
Yeah.
We can, and, we've got, we have a little budget that can
Yeah.
cover that sort of thing. Yeah, so that really is my only, other than
I don't
that,
think you-
just adding that one little amendment, I think we're,
That's fine.
okay.
Yeah,
Shall we vote?
yes.
All in favor?
Aye.
Aye.
Okay.
Let's do it by voice vote, since we're going to sign it anyway. Mr. Slasky?
Aye.
Ms. Peters?
Aye.
All right, and Ms. Papano, chair says aye. All right, thank you very much. Let's get this thing, we'll get it wrapped up. I'll work with you, Sam. What we might be able to do, I'm wondering, is, well, you guys around tomorrow, that if we get a draft, like, that you
Yeah.
could come in and
Yeah.
sign? Okay,
For sure.
all right, then we'll just get it straightened out for the morning, and then come in and sign it, and let's get it
Yeah,
on its way.
I can get it out by the end of
I think the press release should happen as soon as possible because, again,
Yeah. Yeah, I
picking
agree.
up on the right thing to do, I think, is important.
And the press release would go to,
All the news agencies, newspapers, any place that it could be
Yeah.
published that
Okay.
the Board of Health is requesting.
Yeah. Is there do you know, Sam, is there like I know the town has done press releases. Is there like a format for that, for the people that we notify? For Neshoba people, do you have any?
I would have to double check with Robert and Carly on that.
Yeah, okay, all
I
right.
would
We'll figure it out.
Robert and Carly, whatever the intermunicipal process.
Yeah, all right. Well, yeah, we'll figure it out.
We'll get it
There's
cleared
gotta be
up
a
by the end
template.
of tomorrow.
Yeah, there's
Do that.
definitely a template for this,
and
yeah.
the news outlets, I mean, the like news channels have been pretty good about covering and coming out.
They have, yeah.
And I know they have an email address or whatever we could include with
Yeah,
that.
yeah, absolutely.
And I have contacts at the newspaper. I can do that, so.
Perfect.
Just to add to this, the DPH had their release of information last night that they considered essential facility.
Yes.
Yes, that was the.
And that
we should
they're also
explain that.
requesting that it be 120 days in
Yes.
terms of notice, which is Massachusetts general law.
Yeah,
And I would hope that the governor could deploy her resources to the Houston Bankruptcy Court ASAP to request that it be amended.
exactly. And so what document that you're talking about, just for the folks in the audience and those listening at home, is this just came out yesterday, and it's from Dr. Octavio Diaz, who is, or it's two rather, Octavio Diaz, who's the steward, sort of regional chief medical officer. And it's from DPH, and it is quite lengthy, and it runs through in tremendous detail 18 specific reasons why their closure plan is just ridiculous and unworkable, and what needs to happen. And this is extremely well thought through and put together, I think. So just wanted to make a reference to this. We have that added weight of DPH has made this determination. It's not just us as a board saying it. So we'll attach this and we'll make sure we work it into the letter. Awesome. See what we can do. I certainly hope so. I mean, it's crazy. It is just crazy. All right. On that note, what I'd like to do is ask Tamara and Jenna to come up and join us. So I reached out to just Neshoba Associated Boards of Health, knowing that I kind of view you as you're the hub in the wheel. You're the center that we have all these towns with spokes going into, and we may be the host town for Neshoba, but we certainly are not the only town facing these questions. So I threw together just a quick off the top of my head. I know that I emailed it to you. I think I emailed it to you, Trish. If anybody wants copies of it, I have it. But it's just kind of a sort of at least a basic list of tips and points that for people to consider, things to help you make this transition to wherever you're going to need to go.
Before we continue, though, can we introduce these ladies to people that?
Oh, absolutely. Yeah. No, thank you.
From Neshoba Associated Boards of Health, but.
Yeah, please introduce yourselves. I'm sorry. Good one. Thank you, Trish.
Hi, thank you. I'm Tamara Bedard. I'm a public health nurse, and I am your local public health nurse.
Absolutely.
I am Jenna Montgomery, and I am a public health educator and communications specialist with Neshoba Boards of Health.
Thank you.
Thank you. Thank you both for coming.
Yes.
So these were the two ladies that I ended up getting put in touch with as, the ones that have both the knowledge and the outreach abilities. So I really just kind of wanted you to come here tonight to see what's the best way, and we're not going to solve it tonight for sure, but I want to make sure that we have this open communication going. I sent you a list of questions, and they're really simple things like check your prescriptions, get long-term refills if you can, find out think about your new provider. Don't wait until you're sick. Figure out who's in your network, who takes your insurance, and so on. So I want to encourage everybody, certainly here at this table, to keep sending that information over to you guys. Is that kind of the best way to do it, to keep emailing you as we come up with ideas and things that we think maybe would be sort of points of interest if this turns into an FAQ page or something like that?
Yeah, sure. I mean, what I would do, if you want to just send them to me, I will deduplicate anything that's already present
awesome.
on the DPH FAQ page, because there's probably quite a bit of that.
Yeah.
They are maintaining a pretty up-to-date page. We want to make sure anything that we share out from our perspective is has a local bent to it.
Yeah,
right?
yeah.
There's a lot of considerations that are going to be helpful for anybody losing access to the hospital, right? But we want to make sure we're focusing on things that are unique to this area that DPH is not going to capture in their FAQ. That's what I'm kind of thinking. And I got that in reading some of your questions. I was like, some of this is getting at some of those things that are missing, the gaps.
Yeah, it was kind of two things motivating me. One was that making sure that we have all these little kind of everyday new questions pop into my head.
Sure.
But also that the DPH website has a lot of information on it, but especially if you're not particularly good at searching websites and digging for information, can be hard to find the information. So that's why what I thought would be a good thing to do is, if DPH has already addressed it, absolutely, we have to, kind of their opinion is going to be the official word on it. So
Right.
if we could just give people some quick links to, oh, are you looking for the capacity dashboard?
Right.
Click
Here's
here.
that one, right.
Yeah, or here's how to get
Declutter
to
it, kind of. Is that like what you're thinking? Yeah.
Do more like a Q&A kind of, this is my particular concern. I don't want to just start digging through the DPH website and,
Right.
at random.
Right.
But I think it's really helpful to hear, as you might field calls, what kind of things people are asking about and what what the specific concerns are.
Yeah.
Because that will inform kind of what kind of conversations we're having with local providers, because we'd like to, as Jenna was saying, we're hearing what the Department of Public Health is able to answer in their questions from a larger perspective, but then bringing it down to the local perspective here for people's everyday questions and concerns, in this region, and we know that there are unique situations here. We want to be able to speak effectively to those specific things. And so that would be really helpful information to have.
Yeah, and I think in the spirit of kind of accessing the hive mind here and getting us all thinking about this stuff, I would also say if people that are watching, listening, residents, if you have specific concerns you're not seeing addressed anywhere, send them via email to Board of Health. Sam, you and I can kind of sort out who looks at them. We can forward stuff to Jenna to make sure it makes it in there. Questions that other local boards of health are getting, if they're asking that question in Pepperell, chances are people in here are going to have the same question. So, yeah, I'm kind of looking at almost like a no borders kind of thing, because we're all in this boat together. People, like I see an audience member here today that definitely does a lot of outreach in town and has a lot of contacts. Let us know what you're hearing. I had a list. Yeah, that's perfect. That's exactly what we need. And so in the spirit of that, I'm going to send you ladies a detailed email, but I was speaking to the office manager and billing manager at my local physician, Dr. Gustafson, who's Harvard Family Medicine, I believe is the real name of their practice. And she is definitely interested in being involved. I have her cell phone number I'm going to pass on to you. She knows that you're going to be contacting her, and she is all in. But some of the fascinating things that came up as I was talking to her were that there are sort of two levels of these admitting privileges. So the state, and I think we talked a little bit about this today too, where doctors that are credentialed, you're an MD, you've got your state license to practice medicine. So you can practice medicine anywhere in the state of Massachusetts. But individual hospitals give out admitting privileges. And that's a really important thing to know, is that your doctor may have a degree and a medical license. We're not saying they're not a doctor. We're just saying that they haven't done the right paperwork and they haven't been officially granted the privileges. And I know that for that practice anyway, they are doing Emerson and UMass, but it's a lengthy process to get through it. So another thing that would kind of help us if we can get a little bit longer going here. And this is affecting people, this surprised the heck out of me, it's affecting people that have prescribed infusions that need to be done in a hospital, even though that's not, I wouldn't have thought of it as, why do you need admitting? You're not being admitted, you're just going there for the infusion. They've got to have admitting privileges. So depending on what service it is that you need to access, ask if you have a primary care physician, if your insurance is the kind where you have a PCP. The thing that they really stress to me is that PCP will always have access to all your records. Historically, maybe not the films, but they will, at a bare minimum, they'll have lab reports and they will have reports of like imaging studies. So if worse comes to worse, medical records, not only are they setting up a way that, they'll be archived and will be accessible for a while, but that's another thing to keep in mind. You can always go back to your PCP. And one of the things that surprised me was I found out through talking to her that MAT will not transport if you live in Lunenburg and you need to come to a doctor in Harvard, it's not something they cover, transportation. They'll take you to the hospital, but they won't take you to a private doctor's appointment. So I kind of need to even know who to talk to try to figure that one.
I have a contact.
Awesome. I knew.
I already got it going for you.
All right. I knew this was gonna get more minds on this. This would work. But the two things, little gems that absolutely just broke my heart were that they have had people calling their office, elderly in both of these situations, who are afraid to call 911 because they're afraid that they're not going to get to them in time. So as a, I guess, general public statement, definitely, EMS is still there. 911 is there. They're going to take care of you. As this evolves, yeah, we know that we're going to run into longer transport times, but definitely this is not a reason not to call 911. So don't give that a second thought. But the other thing that's interesting is the other reason that they're afraid to call 911 is not just the response time, but it's the, what if I end up having to be transported to one of these, either Leominster or Emerson, I can't get home. I have no way to get home. And I was like, oh, God, that's such a no-brainer. Right, how do you get home from those places? So that's the kind of input that I'm seeking from everybody, and this is definitely it takes a village. So keep ideas flowing, we'll keep funneling them towards you, and then let's just keep our lines of communication going and see what we can set up for accesses. Do you have anything new or noteworthy that you'd like to just get out
in terms of
in terms
what we're
of your
hearing
or what you're hearing, what are people's concerns that we might be missing hearing about from other places?
So far, I think it's all of the things that everyone, the common ones are bubbling up that I think everyone's pretty concerned about. Transportation is key. I haven't heard of anything specifically that's unusual or different than I think what everyone is pretty much hearing right now. And I think that, we are listening, and I think it's important to keep, as you said, the communication going. And Dr. Gustafson happens to be our medical director as well. So that's not a problem to keep those channels of communication going. It's just another avenue that we'll have to get firsthand information to hear what those concerns are as well, and to troubleshoot and to try to be proactive as some of these things are happening.
Exactly. Yeah, that's why I'm looking for just a way that we can get this kind of information out there so it's accessible to residents, to boards of health, to people more on a local level, and it's not as intimidating as having to go to a state website.
Exactly.
And look for stuff.
Madam Chair, one of the things that I'm hearing is that people aren't even aware that this is happening. You don't
People are
have,
showing up to the hospital not
you don't
knowing.
have, you don't have newspapers that people read.
Right.
Is there any suggestion or any ideas that you folks have in terms of how people get just basic notification that this is happening? Because, if you don't have email, and I'm sure everyone doesn't have email, how do you even know that this is happening?
Right.
Are there notices going up in communities anywhere that, the potential foreclosure is, we're talking less than 2 weeks,
That's always a challenge, is how to get people informed. And how do people access information is always a challenge.
Yep, and it's all over the news, but people aren't necessarily putting two and two together about
Or even
this
watching
big
the
goal
news.
thing with Stewart has,
Yeah, exactly. And I know that people do pick up, I'm not on Facebook personally, I know that there's a really active community, both the town webpage and there's one for the Save Neshoba, that things get picked up and reprinted there. So I'm hoping that the people that are, more administrators and whatever for that will feel free to repost or link things.
Right.
Yes.
I think that those yard signs are really helping a lot.
I think so.
I think so too.
They're not just here in town, they're in like you see them as far out as Leominster.
Love it,
Do you believe
It's a
that
visual
that is
thing.
helping with people that aren't on social media or that don't watch them and
Yeah.
news.
Yeah, it's not like the old days where there was a newspaper of record and, you know, it was easy.
How do you do vaccination notices? How do you get that information out?
It's all the same channels that you would expect, right? It's social media, websites, you know, that's the main way that people
Are there any
get.
publications that are posted in places?
Our newsletter went out to you guys, town administrators, COAs, public safety, school nurses, daycares, preschools, food pantries.
Awesome.
A random list of other people
I'm
don't fall
thinking-
into particular categories.
There aren't any, there are less and less of those local free papers and newsletters that
But
used
we
to get
did also
printed.
submit
Yeah.
a press release to all the local papers a couple weeks ago.
I'm thinking Harvard has their own newspaper.
Right.
Is it published in the Harvard
They
newspaper?
put me in. They put an article that I wrote in there last week. Yeah,
Okay,
in the
good.
Harvard Press.
Yeah, some people are still, either, if not, you know, paper physical, then at least online,
Right.
looking to
So
look.
that's really it, right? The answer is you diversify your communications
Yeah.
as much as possible, and you communicate through as many different avenues as you can: electronic, paper, all the stakeholders that you can reach out to in the region, and also that community-based organizations that serve people in the region.
Yeah,
Like MART, Community Health Connections, are a couple like off the top of my head
Yeah.
that I'm in communication
Yeah,
with.
that's right, community health.
And I think, like, to your point of the people that aren't watching the news or aren't on social media, like the visuals, the signs and the red ribbon might prompt someone to ask, what is that about?
That gets your attention,
Yeah.
for sure, yeah. Yep.
Yeah.
Yeah, gotcha. Awesome, thank you so much. Yes, we have another,
There's a rural postal carrier way of getting information to every household in a particular zip code out at a low cost, so that you find in Harvard, I see a lot of those notifications going out from various organizations.
okay, so it comes in your mailbox, comes
Yeah,
through
basically you
the,
send it to an entire zip code without regard to, it's not specifically addressed, but it.
okay, yeah, yeah.
That's a great idea.
That is,
That's
thank you
awesome.
for that. So would that be all those towns though, Jenna?
I think you can select,
Yeah.
individual zip code.
Yeah, we can figure out who are the.
It's very inexpensive. It's much less than a first class.
Is that something that Neshoba
Oh,
could
that's
do and then
fantastic.
bill back to the communities or whatever? Because it wasn't a budgeted feature, but there has to be one organization that does it if we're going to do something like that. Having each Board of Health.
Yeah,
It's just not gonna happen.
And it's
Right.
inefficient. It's
Right.
gonna be pointing in a bunch of different directions. That's, I mean, I'm sorry, I feel like I'm leaning on you a lot, but that's why I'm sort of pushing you as the nexus of,
Yeah.
you know, where we create and hold and manage and maintain this information.
But as far as the cost goes, wouldn't it pertain mostly to the towns that are in proximity of the hospital? Like the 17?
16 and Community of Devon's.
Yeah.
Right.
Yeah, okay. Okay. It would, it probably would make sense to assume that, I would think any of the zip codes that you guys cover are potentially covered, but, for finance, it's, I think we've got some options, either if Neshoba does it and bills back to the town, that's one way. If it makes more sense for it, if it's something that we have to run through, you know, a purchase order or whatever process we do here, let me know, we can do that, that's awesome information, thank you.
I mean, I think our budget would, I can't imagine that it would exceed what we have budgeted.
No, it can't be, it
So-
can't be huge, can't be huge.
We'll take it back.
Is that something you guys, because I think that's a great idea.
Yeah.
you know.
Yeah, we'll take it back.
Yeah. Thank you. Awesome. Thank you so much for your help.
Yeah.
And let's keep ideas flowing at this point. I'm sorry we don't, for the public who came here, I'm sure wanting to hear answers, I'm sorry we don't have answers yet, but we're going to work on rolling out information as fast as we can, because we hear you, we feel you.
Well, thanks for having us.
Thank you.
Thanks for
Appreciate it.
Thank you so much. I'll send you an email with, you probably have it, but I'll send you the contact information.
Yeah, no, that'd be good. Anything,
Fabulous, thank you
anything we
so
can do.
much.
Thank you, guys.
Thanks. Okay, so, sure, yeah, yep.
So
We'll take a 5-minute,
raise their hand.
5-minute break.
Yeah, you're not supposed to really talk in the chat, but for some reason, things got I couldn't shut it off without messing with the camera for some reason.
Okay, so
So you
how
can
many?
read them. There's 9.
Oh, what's the first?
around and look.
BOH email again.
If anyone's interested in emailing the Ayer Board of Health, please send to me. My email is sbenoit, B as in boy, ENOIT @ayer.ma.us. It is also on the Town of Ayer's website.
Yeah, it's on the website. We actually need to.
This is actually a good
What?
question that's up
Which one?
here.
Oh, go back.
The one about we need to appeal to the Texas Bankruptcy Court. The motion that we made to send out that letter is doing exactly that. It's requesting the governor and DPH
Yep.
to get into that bankruptcy court and do what you need to do to keep
What
us
was
open
the-
120.
If you go back up.
I get it. Multitasking.
Yeah. It's not an appeal that needs to be filed, but a motion to intervene.
Yeah.
Commonwealth
Yeah,
needs to,
okay,
yeah, okay,
yeah.
we got that one. It's about 100, because Texas, yeah, okay.
Yeah.
Anyone in contact with the federal prison who uses Neshoba?
Ooh.
That's a good point, and
Good one.
so does Sousa Baranowski, the prisons
Yep.
up in Shirley.
Gotcha.
Yep.
I'm going to put that in my...
Or the local National Guard on Devons. That's another good point, because they're still doing, aren't they still doing weekend warriors? Steve would know, the National
Oh,
Guard.
yeah, right,
When they
yeah.
come up, that would be the hospital, Neshoba would be the hospital they would go to.
Yep.
That's my email.
Oh, good, Sam. Thank you for putting that up.
I didn't. Someone did. That wasn't
Someone
me.
else?
So we've
Okay.
got, the Save Neshoba, so that was the group that I was referring to.
Yeah.
Where, what did we had Federal Prison, National Guard, Sousa, there was a fourth one, what did I miss? It was something else at Devon's.
The National Guard.
Was it just?
National Guard. Steve, they're still doing the weekend warriors up in Devon's and
Of
National Guard.
course. Well,
So how much?
not just National Guard reserves, too.
How much of a population do you think there is up there? You don't have any idea, but.
But no, these people come in from all over the northeast
Right.
part of the United States
Right.
for their 2-week annual training.
Yeah.
There was matter of fact, I met someone that is part of a NATO force.
Really?
Yeah, at Marty's the other morning, there was 2 soldiers in fatigues, and I was
Wow.
talking.
That is fabulous, yeah.
They're on they're part of the NATO support mission.
Yeah. So
Yeah.
we were just reading
Well, they can be hundreds,
the chat.
couple thousand.
Somebody
you know?
brought up the National Guard,
Yep,
the
prison.
federal prison.
Yep.
I know they, Shirley, because my son's done ambulance
Yep.
rides.
Absolutely, yeah,
So
yeah,
we do.
yeah.
Concord and Gardner MCI prison systems also come. Okay, thank you. Federal prisoners are taken to Leominster. Sometimes.
So Robert said he would coordinate the press release on that as well. I just talked to him,
Oh,
so
awesome. I didn't even see him go.
I don't know if
there.
he's-
That was a good one.
he may call the agencies to come here tomorrow. I don't know.
Okay, okay.
And again,
Perfect.
hopefully she does what she should do.
Yeah, exactly, exactly. Those were good points. If we didn't hit everything that's on the chat, send them to us in emails, and if you think of them later, send them to us in emails. Fabulous. All right, so I think we just have a couple of I think we're done with Neshoba.
Great.
Well, we're not really. We're not going to be done with
the
Neshoba
moment.
for a while. Neshoba's done with
for the-
us, or Stewart
for the
is done with
moment.
us. Keeping of animal and fowl permits. We have a situation, and is this in everybody's package?
Yes.
Okay.
Add
So
that.
there is a letter. We have a situation, 3 Union Street, where there are chickens. There is no active permit. We have a couple of, and you'll even see that in the call log. If we go back, I don't think really recently, but
Yeah.
there certainly have been back July 18th, rats at Old West Main Street. There have been rat complaints in this neighborhood. So what we have here is a letter to go out to the homeowners, just saying that we've tried to contact you. I know that they've stopped by, they have tried email contact. So we want to send this out by constable. to make sure that they are served. And then we'll see what happens if we can get them to come. Because the alternative is if they don't respond to this, then it's going to go to town council and we're going to have to look at what can we do for legal action. Do we?
Right?
Yeah.
I think we should serve it, sure.
Yeah, we have to.
And the only thing I was conferring, if this is what I wrote, the only thing I wanted to confirm was that our next scheduled meeting is September 9th. Were we planning on having that?
Yeah. What day is Labor Day?
Labor Day
year?
is the 2nd.
Second, yeah.
Okay.
Yeah.
All right.
So the next scheduled meeting is
Yeah,
September
good.
9th.
So then we're good for that. I
Okay.
was looking at the calendar, and I think that there is a way that we can, if we do those 2 dates in September, I think that positions us okay even for October, but.
Okay.
Yeah,
I just wanted
let's
to
do the
confirm.
September 9th, yeah. But Monday, there was a meeting
And we'll get
for
rid of it.
Monday, yeah, that we won't
And
need. 'cause
I'll
we're
write a
coming.
cancellation for the 26th.
Okay, perfect. You'll cancel that
Because we
one,
have this
great.
one instead. But I just wanted to make sure we're doing the 9th because I did include that of,
Okay.
if you want to come, that's our next meeting to discuss.
Perfect,
Your
yeah.
issue of,
All right, September 9th will be our next meeting, yes, if they wish to discuss.
and
Please.
if anyone has any edits, that would be fine. Otherwise, I will have you sign that, Pam.
Yeah, it looked good to me. Do you want me to just sign this,
That'd be
this
great.
one? Okay, great. Well, that was efficient.
Okay.
Love it. Call log, the aforementioned rat complaint, something about pesticides. These got referred to, there was a question about lead paint, that one went to Charlie.
Yes.
And then question about food trucks, rats and pesticides all went to Bridget.
Yes.
And that's all since the last,
Yeah, and as usual, I have my smattering of calls in which they're looking for.
where they really want Neshoba.
Neshoba.
Yeah.
I would like to sort of put it on the record. The Ayer Board of Health and Ayer Town Hall does not collect sharps. Someone keeps saying we do.
no.
We do not. Please contact Neshoba.
Oh, okay. We could put something even on our web,
It does say it on our website.
It does already?
Yeah, we have something that says sharp collection.
Jeez, okay.
But as it is, I'm not sure where the information's coming from.
Huh.
I've asked a few, it seems to be coming from a few different sources. I know we get mixed up with them all the time.
I think it's
anyway,
that general
but
confusion,
No,
yeah,
it's
yeah.
aired, I've been said, well, no, I was told the town hall takes them. So,
Take a look at what we have on the website
can
and see
update
if, like,
it.
do we need to make that more prominent? Do we need to make
But-
that like a thing that pops up
But
on when you hit Board of Health or?
but the majority of the most recent Neshoba questions beyond the
Okay.
usual ones, which are mostly septic system questions.
Yeah.
Are, I was told you collect sharps and it's like, no, you need to contact Neshoba.
Yeah, exactly.
There's always confusion.
Yeah,
And that's
there
really-
is.
yeah.
Yeah. Yeah,
It's
there is.
fine, I get it. It's just been an extra.
Yeah, exactly. Do you know if is it only Board of Health at Town Hall that's getting it, or are people actually thinking that Town Hall,
No, it's just us.
it's specifically Board of Health? Okay, good. Well, that's good. At least we don't have people running all over Town Hall with their straps, but, yeah.
No one's come in yet anyway.
No, okay, great.
We'll take that.
Nobody's gifted you any?
Yeah, but it's definitely
Yeah.
sharp and medication. They seem to think.
Yeah, the police will take medication. So, yeah, if you could take a look at the webpage
Yeah, I'll
and
just
see
double
what
check
we
the-
might be able to do we might even need to make the thing about the medication a little more prominent, that if you have medication to dispose of, that you can take to the police station.
I can see what's going on over there.
Okay, that sounds good. Any other exciting calls that did not?
No, mostly just the usuals.
Okay.
And we have not, the Board of Health has not received terribly many calls about the hospital, so.
Okay.
And most of the calls regarding the hospital have been confusion in that they're looking for Neshoba.
Yeah, exactly.
Sometimes they're looking for the hospital,
Yeah.
but that's.
Yeah. I know, we have a lot
That's-
going on in this town. The hospital's here, Neshoba's here, where do you
And I will say,
It's
some of
confusing.
it is dependent on the search engine they use.
Yeah, exactly.
So,
Okay, that's fair.
that's Google, not me.
Yeah.
It's not
yeah,
us.
Exactly.
Right.
All right, I have we have 2 minutes.
Yes, we have 2
minutes. We have 2 sets of minutes. I don't know if either of you have had a chance to take a look at them. I did, and thought that they were good.
I'd make a motion, we accept the minutes as presented for June 10th, 2024.
Second.
All right, that gets us this set. I will start, all in favor?
Aye.
Aye.
And Madam Chair, I'd so move that we accept the minutes as presented for July 22nd,
Here's the set signed.
2024 as presented.
I second that.
All in favor? Aye. Beautiful. Now it's signed too. Here you go. Here's the other set signed. Thank you very much. Oh, I so love it that you do minutes. I hate doing minutes. Bills, mail?
I have bills and mail.
Ooh.
I have 2 bills. This is for second quarter to Neshoba Associated Boards of Health.
Oh, okay. All right.
And for the total, this is for environmental and nursing services. The total is $11,405.05.
And worth every penny. Do we need so
Yeah.
you want to move to?
I'll move we
transfer?
accept the quarterly bill from Neshoba of $11,405.05.
I second.
All in favor?
Aye.
Aye.
And I have, this is a bill from Neshoba for a water quality lab test in the
Yep.
amount of $40. This is for the beach.
Oh, let Ms. Peters move on that.
Make a motion that we accept pay the bill for $40 to the water quality lab testing of Sandy Pond water sample.
Second.
All in favor?
Aye.
And the results were good, by the way.
Yes, they were.
Say once more.
And then
Here is that one.
the other,
That looks suspiciously like a mosquito.
yeah, always.
Up to
Always, yes, I received a letter from Mosquito Control. They will be in the area on September 3rd, 9, 16, and 23 for spraying and questions.
Okay.
All right.
Yeah, we're getting close to that time of year.
Yeah.
Again, where we've got triple E and all kinds of other things.
There was a case identified too.
Yeah, I heard there was.
Down that-
Okay, do you know what town it
Was
was?
it Plymouth or something?
It was down near the Cape.
I thought it, yeah, it was farther towards,
Yeah.
like, yeah, so.
It was in a wild turkey, I believe.
What? Really?
All right.
No kidding.
Is that, so that's
West
all?
Virginia
That's
equine.
all I've had. And then for our upcoming
So September,
September 9th and 23rd are the next 2 meetings.
Yep. And September 23rd. So I will, we may have Union Street.
Okay.
I will also talk to, for sure, I'll be talking to them, I'm sure, several times between now and then, Tamara and Jenna, and I really would love to have something that we can roll out that people can begin to access information before then, if possible. So we'll keep
I can
that
work
rolling.
with, I can help work with them, and then if you send me some questions, I can work on.
That would be fantastic. I mean, I don't think it has to be a finished, it's never going to be a finished.
No, but
list,
I can work
but
on something.
yeah, to get something
Because
out.
I do put
Awesome.
some hard copy information outside the Board of Health
Yeah.
office upstairs that people
Yeah.
can collect as well.
Yeah, that would be good. Do you know, Steve, if, because the other thing I think that we should make available for people if they want copies of it is our letter that's going out that we just voted on.
Sure.
And
Yeah.
I don't know where this document is that's public.
I have.
You have it.
I
Is-
have a copy anyway.
Can we, or should, actually, you know what, Neshoba would be the better one to link this, because then they're gonna hit all their towns. Would you mind?
What?
Asking Jim if this is already or posted on Neshoba's website, or if you
Sure.
can?
I will, and
Awesome.
our letters should go on our website.
Yes.
And the Town of Air website.
Yeah, I would think, yeah, I would think so too. But this one, I just want to make sure people can access it. It's really, really detailed.
Oh, it is.
So this is very well done.
Yep.
You don't know if it's on,
I'm not sure if it's already up on,
Showbiz?
on the Showbiz
I think
or
I've
not.
read it online, so it's
Okay.
loaded somewhere.
Okay, okay.
so we just need it on ours?
Yeah, it's, if anybody is searching around for it, it's an August 20th, 2024. It's called Review of Transition and Closure Plan, and it was sent from DPH to Dr. Diaz at Stewart. And it outlines exactly what DPH is objecting to in the transition plan, is a generous way of describing it, I guess.
I think it also incorporates some of the comments that were made at the public
It
hearings
does,
as
yeah.
well. So
Yeah, it does a nice job of sort of bringing in that information, and that this is what we heard, this is what we all heard from.
clearly, they were listening. you
Yeah,
know,
yeah,
And
yeah.
to have the attention of DPH, I think, is incredibly important. And, hopefully,
It is.
it's important to the governor.
Yeah, yeah, absolutely, absolutely. Okay, fantastic. What else is on for tonight? So I think in terms of upcoming, some of it might be a little bit fluid, but I would imagine for sure we'll have something about Neshoba on, again, even if it's just an update. Might have something for Union Street, might have something for other stuff, so we'll stay in touch to keep that
Sounds good.
that update.
And I will be around. So
All right.
One thing I didn't mention in talking to Neshoba, and I think you got the message from Jim, he sent it to you.
Yes.
They endorsed that letter as well.
Yes, yeah, he did a reply to us, said that does sum up their position on this as well, so.
Yep.
Fantastic. We have our esteemed town manager in the audience. Are you here for entertainment, or would you like to address us?
I was just coming to say hello.
Hi, to the audience, you're always
Pop in.
welcome.
Madam Chair,
By all means,
Yes.
join us at the big table.
Madam Chair, members of the Board of Health, I just want to say that we greatly appreciate your continued efforts and leadership on the hospital issue. And I think one of the things that the town is going to do, I talked to Cindy today, because there's so much new information, just as you mentioned, it's coming out about the hospital.
Yeah.
Of course, we're going to post it to your page, but I
Yeah.
think we're going to create, I talked to Cindy today, like a hospital page right on the front of the website that will take all of the stuff that you've been doing.
Yeah,
I know you've
yeah.
had some statements and letters and stuff.
Yeah.
And put everything related to this, just so people can click in one spot. So
Yeah.
still posting it to
Yep.
the Board of Health webpage and what have you.
Yeah,
But we're
yeah.
talking from, all departments. But I was just, happened to be in the building, heard you were meeting,
No,
just
that's-
wanted to come say
That's
hello.
awesome.
and-
I appreciate your offering to help us with the, I've
Yeah, I
never
understand you're
done
going
a
to
press release.
do a
I've not.
press release, and
no idea how
I
these
said
things
to
are done,
Steve,
so.
whatever we can do
Okay.
to help facilitate that, we're here. So nothing specific,
That's
but just
fair.
wanted to thank you for your ongoing
Beautiful.
efforts, not only on the hospital issue, but all the health issues.
It takes a village, it really does. I love that statement, because it's so true of so many things, and the town is in turn supporting us, and Neshoba is too, so we may be losing a hospital, but we are a very fortunate community in
Yeah.
the way that we pull
Yeah,
together.
they've stepped up.
Yeah, absolutely.
have.
All right.
Thank you to
That's it.
everyone that did their part in this.
Thanks, Robert.
Thanks,
Thank you.
Robert.
Thank you all.
All right, do we have anything else, or
Motion to adjourn.
I will entertain motions? All right, motion has been made
I second it.
and seconded. All right, all in favor?
Aye.
Aye, we are adjourned. Thank you, everyone.